Okay, so let's talk a little bit about why we prescribe bioidentical hormones. Now, a lot of patients are being told that there are great options at the regular drugstores to use, such as micronized progesterone called prometrium, and then a different kind of estrogen patch called Vivel dot or estradiol patch. Now, prometrium, if we clearly look at the ingredients, is not a healthy version of bioidentical progesterone. It contains ingredients like peanut oil, red F40, all these colors and dyes and artificial ingredients. Now, if I'm trying to live a healthy life, the last thing I want to do is put back into my body a hormone that contains all of those nasty ingredients. Now, if we look at bioidentical progesterone, that is compounded using a wild yam base, and then it can be compounded to all different doses. So I don't have to also just use the doses available for prometrium, which are 100 and 200 milligrams. I can use anything from 5 milligrams to 500 milligrams. So I can customize it and tailor it to you. Now, is cost a huge difference? No. Most of our compounding pharmacies will charge almost what's close to your copay for your regular medications like prometrium, but there's so many advantages to using bioidentical compounded progesterone from a compounding pharmacy versus synthetic prometrium. Same for the estradiol patch. It has estradiol, but the other ingredients in the patch itself can lead to rashes and other issues that can be problematic. Now, the bioidentical version of estrogen called Biest, we can also customize into different formulas, but the biggest advantage is that we can additionally use the estrogen 3 called estriol. And we feel that estriol is actually one of the safest estrogens to replace with. So, in general, we like to use a combination of about 80% estriol and about 20% estradiol. And that's not going to be for every single woman. Sometimes we have to use a 60-40 formula or a 50-50. But again, we can customize that for you. Also, that is also compounded from a wild yam base and put into clean base ingredients that will be able to easily absorb into your skin, which again is much safer to use than oral estrogen. So please don't use oral estrogen. That is one of the most concerning types of estrogen because it can be processed by the liver and create metabolites that can increase your blood pressure and can cause blood clots. So transdermal estrogen is much safer. And again, using the bioidentical compounded estrogen is a much safer version and a better option, I believe, than using the estradiol patch by itself. Now, again, we can be very customized and tailored to you. And for some women, yes, estradiol patch is fine. But just to let you know, there are definitely some great options.